pressures on local GP services. Pressure on local GP services. James.
Thank you. I think it's actually quite a complex question. I think one of the big issues that has been raised with me by certain doctors in Leicester is the issue of the problems around social care and social care planning, where very often increasing numbers of elderly people or people with mental health problems have ended up in GP surgeries, increasing the workloads, partly because of things like social care cuts. We also know that there are actually severe shortages of GPs in certain areas. That's why the Labour Party has put together funding commitments for 8,000 GPs and 20,000 extra nurses as a long-term plan to save the NHS. But the actual issues of demand are long and complex ones, and I don't think any party has really solved the problem at this stage or come up with a comprehensive plan. I think what we need to do is put the investment in, review the workloads, and actually ask the questions, what are GPs there for? GPs should not be there to simply mop up problems in the social care system. The social care system should be there to protect people at all stages of their life and be comprehensive. And what we want to do as the Labour Party is to integrate the social care system with the National Health Service and effectively create a national care system in the long term so that all people who need social care are guaranteed it free and quality use.
Mr. Hudson.
I actually come from a medical family. There's no GP in mine. My parents both worked in health service for years. My sister and my wife have done so for many years as well. So we are great believers in the NHS, and as a party we are committed to at least £8 billion a year until 2020 to try and address the issues that the NHS has got. I realise that's not specifically talking about GPs, and there is a huge, as you say, crisis with local GPs and people not wanting to enter the profession. Like the Labour Party, we actually agree we should integrate the health and social care budgets, because I think an awful lot of money has been spent in different areas and not a great deal of coordination, not just in the last 5 years, but over significant decades. One of the particular areas for us that has been hugely neglected, and again I know GPs are involved in this all the way through, is the mental health care. And we specifically want to put an extra 3.5 billion into that, because mental health care has been one of the issues that has not been properly addressed by successive governments, and it's also an issue that's particularly close to my heart, with the issues arising from veterans from the armed forces who are not receiving appropriate mental health care. I realise that's one specific issue. In terms of what we can do for GPs, we certainly need to work with them and to make sure that their working conditions and the things that are being asked to do are properly funded, but also properly supported. And it's really incredibly important that we increase the number of GPs, but also look at other medical staff, particularly nurses. I think we're facing a similar crisis with nursing. A lot of trusts are having to go overseas and recruit overseas to get nurses on the front line. I have to say, this is entirely a personal opinion, and you were asking about what I would do if I was elected. I'm not clearly standing to be elected, so in a purely personal capacity, I would like to say that I think that while the aims and objectives of the Lansley reforms that were put together by the government were laudable in what they were trying to achieve, they were handled in such a quick and unthought through way that even the Prime Minister is now admitting that perhaps they should have embarked upon this. And it is something we have to look at. And again, this is too big an issue to score political party points over. The NHS is the pride and joy of this country. It employs more people than the People's Republic of China. We are very lucky to have that healthcare system, and it is the envy of the world. So we need to properly fund it, and we need to properly support the practitioners.
Alan, on current situation of health provision in the county.
I know this is elections, everyone's supposed to court popularity, but I'm afraid I can take issue with the question, because it does not reflect what I see and what I hear in my job as an MP. I haven't had a single representation from a GP expressing the same view as the questioner.
Dr. Chiverton has been a GP in this town for 30 years.
Yes, well, you take my next fine. There's no come to see me, and I'd like to ask her to do so after this election, because most people I find in Rutland are very pleased by the service they get from their GP.
Bit out of touch.
Okay. This is what politics is all about.
I must press you on that.
No. They just have. They just have. Don't worry.
I think there's a difference between people being happy with the provisions, what they get, but recognising the huge pressure that the Oakham surgery is under. People will tell you here the enormous pressure to get appointments, to see your GP. That the morale within the medical partners in that practice, sometimes I think they need to see people themselves. It is low.
Okay, good. Good in the sense that it's important that we know that. Look, if that's the case, and it is extraordinary that here I am as the MP, that no delegation has come to me to say, please can I talk to you about this? And I have an office staffed all the time, open all the time. We answer letters straight away. Most of the problems we have at GP are about hospitals, where we're getting, I think, quite a good reorganisation of the Leicester hospitals. For some in the south of Rutland to go to Kettering, it is not so good. I'm unimpressed by Kettering Hospital. Those who go to Peterborough feel well served. Those who go to Leicester, most of them. But if there is pressure in the GP service, as we've heard tonight, then thank goodness for politics and public meetings, where this is as clearly expressed as it has been this evening. And I undertake, from May the 7th onwards, should I be elected, that I will ask you, as the doctor who's asked this question tonight, to bring a group of people to come and see me so we can thrash out exactly what you mean by the pressures in the surgery. And I, as a local MP, as I always do, and have done for over 20 years, when a local issue is brought to me, pursue it very, very strongly. And you know that when I get to grips with something, I make a noise and I normally get things done.
Thank you. Mr. Billington?
Thank you. I come from a medical family. Both parents worked for the NHS. My father was a state-enrolled nurse. Now, one of the issues about the NHS is probably we don't have enough of the right trained nurses to do the jobs. We don't have state-enrolled nurses anymore. Nurses have to do a 3 or a 4-year degree course. And there's been talk in the press that we probably don't need nurses to be trained to a degree standard to fulfill their roles. On the GP question, we need more GPs to help the pressure in Oakham. So UKIP would solve it by providing more money to get those GPs in, but not necessarily from bringing them from abroad. We need more training to get our own students up to the level to be GPs, and we need more local people to be trained as nurses of all types. So it is a supply problem, and obviously we need more surgeries. So those are the ways that we will solve it.
Ms. Gordon, we're going to have to be quick now so we can get 2 more questions in.
Okay. Yes, I think the simple answer, if there's more people, then we need a bigger surgery. And I think that we should invest more in doctors. And I know that some doctors at the moment, as been said, are not sort of wanting to become GPs. Then I think if we can do something to sort of, if we can afford it, of course, is to make these surgeries bigger and to make it easier and for people to see GPs and to lessen their load and perhaps have more nurses on board, then I think this would be okay, because I truly believe in my heart that the NHS is a brilliant system and we should do what we can to help as many people as possible. And also as well, when you think of the junior doctors, how much work they do sometimes in hospitals and that. And I certainly think that we should have more doctors, and I think we should start as well for universities to encourage people to become doctors by reducing the fees. Somehow or other, we've got to do that. Thank you.
Final comment, if we can be quick so that we can get on to the next. You don't want us to miss the last question, you see, Mr. Greenberg.
I'll have to shut it on that one. The question really was looking at the pressures that are facing our GP services, both locally, but it isn't just a local problem, it's a national problem. It covers the whole country. And it's to do with a holistic approach to the NHS. We need joined-up thinking. When you cut social care by £700 million in 3 years, as we did at the start of this Parliament, the knock-on effect is obviously going to be more and more people need to go and see their GPs because they can't get the social care they need in their own homes. What we need to do is relieve the pressure on GPs, not by just having more GPs, although that would be nice, it doesn't solve the problem. We need to look at what the problems actually are. The problems we face are simple. Well, not simple, very, very complex, but the solutions are quite obvious. We need to invest in proper social care. If you need social care, you should receive it, free of charge, covered by our NHS, with joined-up thinking. That's why we need to invest more in our health services. We need to invest more so that 29,000 people don't die early every year from air pollution. They're things we can solve. We can solve these problems, but we need to invest properly in our health service.
Thank you. There's a reaction now on health, but